Depression can affect anyone, any age, race, or gender. Depression can affect anyone from children to the elderly. 1 to 5% of elderly people suffer from depression. Depression can happen from an event from a breakup to a death. Symptoms of depression differ in children and adults. There are many signs of depression, such as appetite or weight changes, change in sleep patterns or loss of energy, and poor concentration, just like this driver right here. Other signs of depression is fatigue, sluggish, and physically drained. Even small tasks are exhausting or take longer than normal to complete. Also, other signs of depression are feeling helplessness, like nothing will ever get better, loss of interest in daily activities, getting irritated very easily, and reckless behavior. Now, there are many types of depression, such as major depression, dysthymia, adjustment disorder, bipolar, and seasonal affective. Adjustment disorder is when the patient has to adjust to the nature around them. They don't have to control over anything. It's just the way it is. Seasonal affective is when the patient gets depressed due to the fact the seasons change. They need to be under a special light that mimics the sun as ultraviolet light. This will usually happen when winter comes around, and the sun is not out as long as it would be in the summer. Bipolar depression is when the patient has their ups and downs. They're happy one moment, then sad. Dysthymia is not as severe as major depression, but it will last longer. Major depression is when sadness is lasting longer than 2 weeks. There are major risk factors when a person is depressed. The person can commit suicide, have financial strain, have serious loss or difficulty in relationships. Women get depressed 2 times more than men do, mostly due to having responsibilities at work, home, and primary caretakers for children and their aging parents. Now, there are only a few ways to treat depression. One way is to take antidepressants. Another way is electroconvulsive therapy. Electroconvulsive therapy, also known as ECT, is an electric current that is passed through the brain to trigger a seizure, which lasts about 40 seconds. It's used on patients who can't take antidepressants. There are also other treatments to depression, such as psychotherapy, it's also known as talk therapy, and there's healthy living, such as maintaining proper sleep habits as advised by your healthcare professional, eating a well-balanced diet, managing anxiety as advised by your healthcare professional, participate in a structured and supervised experience program as advised by your healthcare professional. You can help the depressed people too. You can help, but you got to know what to do. Set boundaries, speak up for yourself, stay on track with your own life, and seek support. You can start the conversation by saying, "I wanted to check in with you because you have seemed pretty down lately." When you help, you will experience emotions including anger, sadness, helplessness, and other emotions. You can ask questions like, "When did you begin feeling like this? How can I best support you right now?" What helps to say is, "You are not alone in this. I am here for you." Avoid saying, "It's all in your head," and just snap out of it.